Do you think that I know that in the House, what's that guy? The French guy is the health minister.
Yeah, his name's Minister Duclos.
Yeah. Now he one of the things he does, and it's a manipulative tactic, is he always likes to bring up the U.S. The U.S. because we saved this many lives, but Canada's population is significantly different from the U.S. And so relating the two numbers, like I'm not a statistician, but I know accountants and statisticians, and they've said that it doesn't equate. You can't use such a drastic population difference and make the same reference. Why hasn't that ever been called out before?
Look, I think it's a tactic. I think it's been it's certainly been called out in the sense of like that's not what we're talking about. We're not talking about the efficacy of a vaccine. We're not talking about how many people potentially it saved. We haven't had the conversation yet on how brutal these lockdowns have been, how they've been on mental health, how they've been on a large uptick in use of opioids, how they've
Yeah.
changed an entire generation of people, which you don't have to go very far to see. I speak to people every day whose teenagers are not the same, we've, because of a health decision they've made. I spoke to somebody yesterday, they've killed their kid's hockey career because they've
Yeah.
lost out on 2 years and they can't play. And these are these are just
The tip
the
of the
government
iceberg. Yeah.
sees these as a minor inconvenience, and this is what's happening all around us.
And I think